Coagulation factor nomenclature. Factor 1, fibrinogen. Factor 2, prothrombin or prethrombin. Factor 3, tissue factor. Factor 4, calcium. Factor 5, proaccelerine, accelerator globulin, and labile factor. Factor 6 doesn't have a name. Factor 7, proconvertin, serum prothrombin conversion accelerator, stable factor, and autoprothrombin. Factor 8, antihemophilic A factor, antihemophilic globulin, and platelet cofactor 1. Factor 9, Christmas factor, platelet cofactor 2, antihemophilic B factor, and plasma thromboplastin component. Factor 10, Stuart factor, Stuart-Power factor, and autoprothrombin 3. Factor 11, antihemophilic C factor, and platelet plasma thromboplastin antecedent. Factor 12, Hitchman factor, contact factor, and glass factor. Factor 13, fibrin stabilizing factor, leukerolan factor, fibrinase, plasma transglutaminase, and fibrinoligase. The other factor is called prekallikrein or also known as Fletcher factor. The other one is high molecular weight kininogen or Williams factor, Flogeiac factor, contact activator factor, and Fitzgerald factor. Next is the pathway, intrinsic pathway, where in intrinsic pathway there are three activators: chemicals, platelets, and collagen. But collagen is the most important to activate factor 12. Factor 12 then be activated into factor 12A but only in small amount only. In order to continue the pathway, factor 12A in a small amount will activate prekallikrein in the presence of high molecular weight kininogen. Then prekallikrein will activate kallikrein, and kallikrein will activate factor 12A in a large amount. And this time, the large amount of factor 12A will target factor 11 and will activate factor 11 to factor 11A. Then with the presence of calcium, factor 11A will activate factor 9 and will be converted into factor 9A. Factor 9A then will activate factor 8, and factor 8 will be activated into factor 8A. And then calcium and phospholipid will join together to form a complex, factor 9A, 8A, calcium, and phospholipid. And this complex will continue to the common pathway. Next is the extrinsic pathway, where there are three activators: endothelial damage, silicon, and glass. These three activators will activate factor 7. And with the presence of tissue factor, it will activate factor 7 to factor 7A. And in the presence of calcium, it will add and form a complex, factor 7A, tissue factor, and calcium. And this complex will go to the common pathway. And next is the common pathway, where factor X will be activated into factor XA and factor 5 will be activated into factor 5A. And joined together, it will form a complex, factor 10A, 5A, calcium, and phospholipid. This complex will be called prothrombinase. Then prothrombinase will cleave factor 2, and factor 2 will cleave fragments 1.2 and fragments 2. And then fragments 2 will join itself to the prothrombinase and resulting into a prothrombin. And then prothrombin or thrombin will cleave itself to form fibrinogen, and fibrinogen will cleave into fibrinopeptides A and B and fibrin monomer. And fibrin monomer is a single strand, so it will continue to cleave itself to form fibrin polymers. But fibrin polymers is not yet stable enough to be a fibrin stable clot. So it will activate the second activation of thrombin, where thrombin will activate factor 13. Factor 13 will activate factor 13A, and with the presence of calcium, it will stabilize the fibrin polymer into a fibrin stabilized clot. And then if we have a patient or person has a factor 13 deficiency, the clot will be subjected into 5M urea, where the fibrin polymer is soluble and the stable fibrin clot is insoluble. So if the clot will be dissolved, it is not a stable fibrin clot and the person has a factor 13 deficiency.